I spend a lot of my life talking about platelets, thinking about platelets, checking platelet counts, hoping the platelets are either increased or decreased. The simplest explanation is that platelets are an important part of blood clotting. In a hospitalized patient, the number one reason for elevated platelets is going to be a massive inflammatory response, either to trauma or serious medical illness or surgery. This is a normal reaction of the bone marrow to stress. Most of the time when I see patients for elevated platelets, it's in the clinic setting. So in the outpatient setting, the number one reason your platelets are elevated is going to be iron deficiency. I have a couple of videos about how iron deficiency increases platelets. There's several different mechanisms, but this is a cytokine mediated response. Marrow, if you're iron deficient, you can't make red blood cells efficiently. Hematopoietic pathway shifts from red blood cell production to platelet production. So the first thing I do when somebody comes to my clinic with elevated platelets is I check their iron. If their iron is low, I replace their iron either orally or with IV iron and repeat the platelet counts, and often they go down. Now, there is a primary blood disorder that causes elevated platelets. There's a few actually. They fall under the category of myeloproliferative neoplasms. These are a group of chronic blood cancers where there has been an acquired mutation in the genes of the hematopoietic stem cells that inappropriately causes the bone marrow to make an excess of blood cells, so myeloproliferation. The myeloproliferative neoplasms, or MPNs, are chronic myelogenous leukemia, polycythemia vera, essential thrombocytosis, primary myelofibrosis, and there can be overlap. I've ruled out iron deficiency or a chronic inflammatory condition in an outpatient with chronic elevation in their platelets. The next thing I do is check for a myeloproliferative neoplasm. I'm usually thinking about essential thrombocythemia if the only thing that's elevated is the platelets. Although the only way to definitively make a diagnosis is with a bone marrow biopsy. But I usually start by checking the peripheral blood for mutations in JAK2, CALR, and MIPL or MPL. It is not uncommon for CML to present with thrombocytosis or elevated platelets, and so I check for the BCR-ABL1 translocation, which is diagnostic of CML. Those tests can all be checked on peripheral blood, but again, a bone marrow biopsy is needed to confirm the specific MPN diagnosis. The other reason why your platelets might be elevated chronically is if you have had your spleen removed. So platelets can be elevated due to trauma, inflammation, iron deficiency, a myeloproliferative neoplasm such as essential thrombocytosis or CML.